good evening. We are back again live from Watany Ophthalmology Summit. It is our pleasure to have Dr. Omnia Bin Hammam, our dear guest from the United Arab Emirates. She's a consultant ophthalmologist and head of the scientific committee in the Emirati Ophthalmology Society. Good evening, doctor.
Hi, Dina. How are you?
I'm good. How do you like your stay in Cairo so far?
Amazing. I enjoyed the days here.
That's very good. So, Dr. Omnia, can you share with us the experience in Emirates in raising awareness to different eye diseases?
Actually, for the last 3 years, the Emirates Society focused on the awareness programs and to increase really the awareness against the diseases which we found that they are really need
Prevalent.
in UAE. So in our program, in our agenda, we have 4 activities per year. We have the glaucoma day, which is on the same glaucoma week actually, which is happening in the same period of the World Glaucoma Week. And we have the diabetic retinopathy day. We are doing that during the World Diabetes Day. We have the World Sight Day as well, and the ocular trauma week awareness. So we have those 4 activities now for the 3rd year. And we are trying actually to engage all the public societies, even sometimes the media, the well-known names.
The private sector.
The private
as well.
sectors, not really the medical institutes. We are trying actually to engage even sometimes we engage the اتصالات. We engaged a lot of entities.
That's very interesting. So, what are tell us about the activities that you do, just to give us idea,
Yeah, maybe I'll talk mainly about the glaucoma week because this is my subspecialty, and maybe I did a lot of
passion towards glaucoma.
As well, the World Sight Day. We used to do some activities in the parks, like sport activities.
Good.
And at the same time, we actually educate the public.
Did you do any screening on the side?
We did that for the glaucoma week over 1 year, and we did also for the diabetic day. One of the nice things that we engage also the schools for the previous 3 years.
Good, yeah.
And we had great support actually from the Ministry of Education and from the minister himself until today. So for the first year, we engaged 40 schools in UAE.
So you're all over. You're not focusing.
Yes,
very
all
good.
over. So
That's
actually, we're trying actually to find a different type of age, and just to raise the awareness among the old population in UAE.
Yeah, that's very interesting because what you say, you're targeting children in schools and you're targeting families in the park.
Yes.
So
we believe that it's better to raise the awareness early and to educate the new generation about all those diseases.
That's very correct, actually, because it's worth mentioning that glaucoma is a silent disease. So screening is much better than treatment. So, and tell us about the World Sight Day. I hear you're very interested in the project.
Yes, the World Sight Day, which is really interesting in it, that we used to treat our patients until certain maybe level when we cannot do more for them, and we stop seeing them, and they don't need the ophthalmologist anymore. So we don't have really contact with those patients. For myself, I feel like we failed or we cannot give them any more support. So for our first World Sight Day, it was maybe our first time, the whole team, we are a big team actually working on in the project. We discovered a different side that our patients who were before they were our patients, and they don't need for us anymore. They are suffer from different things. And even the community,
the vision is compromised very much.
And so now they are not involved really
in the
society, and they became isolated in their institutes, while our country giving a lot of attention for those patients, but still the community need to be more educated how to deal with them, and we need also to approach them and to involve them in the community more. So there's maybe small things we need to take care of it. and how to deal with them. So and even they have needs, which
Of course.
so in the World Glaucoma and the World Sight Day, we used to ask those patients what they need really and what they expect from the community, and we discovered many things.
Oh, interesting.
Yes, so we
That's a-
create a real relation. So even we involve them in our other activities. So we
Yeah.
used to involve them as instructors,
Good.
and yeah.
Wow.
So I enjoyed a lot to work for
That's
this
very
activity.
progressive, and I'm sure we can learn from your experience here in Egypt. One final word, what would you like to tell families with the visually debilitated patients?
Yes, those families really they have to support. They have to support if they have one patient, if they have one of the member who has really a big problem. They have to support him, and they have to push him to be engaged in the community. Maybe especially in our Middle East, we have really good support to those patients to the level that they became dependent to the family. This is what's making the difference between our the Middle East and maybe
Western societies.
Yeah, yes, exactly. There you can find those patients. They are really independent. They can go outside alone. They work, and they're so happy. But we are supporting extremely the visual impairment in the family, while we have yes, we support them, but we have to help them to be independent. Yeah,
that's very correct. And thank you very much for your time. We enjoyed your conversation.
Thank you.
And we're very happy to have you in Cairo.
Thank you, Dina.